I'm Dr. Stephen O'Day, and I am the co-director of the Melanoma Center at the John Wayne Cancer Institute at St. John's Providence Health System. It's very important to me as a treating doctor in the trenches of cancer to be sure that we give the best possible specific treatments, but we don't ignore the person as a whole.
Anyone who has a history of a melanoma or a high risk of having melanomas could come see us for an initial evaluation and a risk assessment. So one of the nice things about our clinic is that we can see patients on short notice, those who didn't have a referral from a dermatologist. So if a patient has a changing mole that they're worried about, they can always call our offices, and usually we're able to see them within 1 to 2 days.
Well, I think what makes our center actually really special is the fact that we're so collaborative. Not only do we have medical oncologists, but we also have surgeons, specifically with background in melanoma.
In the clinic, we have world-class surgical oncologists that specialize in melanoma, working side by side with world-class medical oncologists. And in addition, we have radiation oncologists that are also in close proximity. The John Wayne Cancer Institute has been a center of excellence in melanoma since the 1970s, when Dr. Donald Morton really developed and pioneered some of the early surgical treatments of melanoma.
Dr. Donald Morton's greatest legacy was his skill in addressing clinical problems and then using scientific research in order to answer them.
So for melanoma, we think of treatment in 2 different areas. One, removing the primary tumor. The second is evaluating the lymph nodes. And so we use a procedure called the sentinel lymph node biopsy, where we test the first draining lymph nodes from that area and save the patient surgery that would remove all the lymph nodes.
We developed sentinel node technology and the procedure here, and it was successfully tested in a multi-center, multi-state, multinational NIH trial. The sentinel node is the first node in the echelon of drainage from the tumor. It's like a river system. The cells float through the lymphatics until they land into the lymph node. By doing that procedure, though, and by developing it such, we were able to then expand into the multi-center trial to look at the sentinel node alone versus the need to go ahead and do a final complete dissection.
We have a very important complementary program with a psychiatrist leading a psychosocial team, and this involves relaxation techniques, managing mental health issues, exercise, diet, and interactions with loved ones.
The resources we have are complementary, so it's part of the team approach that we have, not only treating the cancer, but treating the person as well, including physically, emotionally, spiritually. Whatever the patient really needs is what we're there for, to help.
We're known all around the world. We certainly like to see as many patients as we can to provide state-of-the-art care. Anybody that has a skin tumor that there's any question about the treatment should consider coming here.
What is special to me is the day-to-day, very personal, intimate interactions with people in crisis from a diagnosis of cancer, and helping ease their burden and being sure that we offer them the best possible treatment.